Always something. Thank you. Welcome everyone to the MD 988 Fund Campaign webinar. As I mentioned, I'm Adrienne Bridenstine, Vice President of Policy and Communications at Behavioral Health System Baltimore, and I'm your moderator this afternoon. This webinar is being recorded and will be made available on the fundmd988.org web page or website. So as you're joining, please type your name and organization into the chat. What we're going to cover today is a number of things. We're going to start with some quick welcome and introductions, but then we're going to give some national and state context for 988. Where is this coming from? Why is it important? Why should we as a group be focused on that here in Maryland? We'll tell you a little bit more about what the MD 988 Fund campaign is and how you can get involved and what we'll be doing over the next several months to advance the campaign. And then finally, you'll hear from perspectives from a panel of organizations that are already supporting the MD 988 Fund campaign. We've got a great panel of presenters for you to hear from today. We've got our partners from Vibrant Emotional Health, Laura Evans and Matt Taylor, who will be providing us with that national perspective. Dan Rabbit, Policy Director for Behavioral Health System Baltimore, and then our esteemed colleagues and panelists, Katie Rouse from On Our Own of Maryland, Jonathan Davis from Baltimore Crisis Response, and Laura Torres from Howard County General. So without further ado, I'd like to turn it over to my colleagues at Vibrant to give us that national perspective. Matt and Laura, take it away.
Great. Thank you so much, Adrienne. And thank you for having Matt and I here today. My name is Laura Evans. I'm the Director of National and State Policy with Vibrant Emotional Health on behalf of the Lifeline. And I am also joined by my colleague, Matt Taylor, who is the Director of Network Development for the National Suicide Prevention Lifeline. So if we go to the next slide, we'll have our standard disclosure here that what the information that is shared by Vibrant does not necessarily reflect the views of the U.S. federal government by which the Lifeline is funded. That is on the next slide. There we go. And so we can move to the next slide and say, well, what is the Lifeline? So the National Suicide Prevention Lifeline was established in 2004 with the mission to effectively reach and serve all persons who could be at risk of suicide in the U.S. through a national network of crisis call centers, or what we are referring to as contact centers. So you can reach the Lifeline by calling 1-800-273-TALK, 1-800-273-8255. By calling that number, you can text 1-800-273-TALK, and you can also chat online. So the Lifeline is a partnership with the federal government. It is a SAMHSA program that is for which Vibrant serves as the administrator, and we're very proud to have been the administrator since its inception. So those are the ways that you can currently reach the Lifeline. And you know, I also wanted to talk through a little bit about how the Lifeline works. So when you call that number, you will hear a greeting. And the greeting says, if you're a veteran or calling in regards to a veteran, you can press 1. And if you do press 1, you're connected to the Veterans Crisis Line, which is operated by the VA. So you're taken out of the Lifeline system. You could press 2. You have the option to press 2 if you would prefer to speak in Spanish, and you could reach our Spanish subnetwork. Again, a collection of centers who specialize in for Spanish speakers. And if a person doesn't press 1 or 2, then they are connected to the nearest contact center serving their area based on their phone number. And that contact center has roughly 30 to 60 seconds to pick up your call. And it's really important that local centers are able to connect with the caller, because talking to your local center helps build that trust with the caller. You know what resources are available, you understand the local stressors. And so our preference as the administrator is always to have local centers answer the call. But we know that that's not always possible despite their best abilities. You know, crisis centers may not have the capacity to answer that call. And so in that case, the call is pulled back from that local center and placed into our national backup center, our national backup network, which is a collection of approximately 9 centers that have additional capacity that answer such calls all across the country that are unable to be answered at the local level. It's really, as I mentioned, having that local center presence is very important. And what we've heard from most of our centers is that they do not receive funding from their state to answer Lifeline calls. The majority of the centers have self-reported that information. And so as we are talking about this transition to 988, and we're anticipating more, a higher volume of calls coming in, we want to make sure that kind of policymakers, advocates are aware of their local centers and are able to support them so that there is that capacity. We're very proud to have 8 Maryland centers in our network, and they're doing phenomenal work. And of course, we would love to see additional support for those centers. Matt, did you want to add anything? Or all right, so I'll keep going. So now that we know what the Lifeline is, well, what is 988? And so the 988 is essentially, and I've pulled out 2 quotes here, both from the federal legislation that designated 988 and from the FCC, that 988 is the universal telephone number to reach the Lifeline. So everything that I just went through will now be accessible via 988 starting July 16th, 2022. So in the very strictest sense, 988 is just a telephone number change. So instead of having to recall 1-800-273-TALK when you're in the middle of a crisis, which can be virtually impossible, you now only have to remember 988. So that is 988. But of course, when we're talking about the opportunity that 988 presents, we're also talking about a systems change. So I'm going to kind of start through just a little bit of history of the 988 policy timeline. So again, July 2020, so last year in July, the FCC said, we will require telephone providers to forward or kind of make any call that's dialed to 988 go directly to the Lifeline, because it's so important for people in crisis to have that connection. Then Congress followed up in October 2020 saying, yes, we agree that this should be done. And not only do we want FCC to do that, we need some reports just to think about how we can change our entire crisis continuum. FCC in April released their report on providing location information. So again, making sure that we, it's feasible to make sure that we're routing numbers to the correct center. And so their report was released, and more to come on that. November 2021, so just this month, the FCC finalized their text to 988 report and order. So again, you can reach the Lifeline starting July 16th, 2022 by texting 988, and more to come on that. That was just released. And then we're still waiting for some reports from SAMHSA and the VA about the resources necessary, how we can better serve high-risk populations that we know are at higher risk of suicide and mental health crises. And then of course we have the July 16, 2022 operational date. So very high level overview, but essentially kind of those are the key dates to keep in mind, particularly that July 16th date. So, in order to help the states kind of prepare for this implementation, lots of groups, including Vibrant, got together and created model legislation to help think through connecting this crisis continuum. So model legislation that has been shared across the country includes designating 1 or more contact centers to serve and to answer those 988 calls that could be coming into Maryland. Thinking through the mobile crisis team utilization, making sure that there are mobile crisis teams who could be deployed in place of law enforcement and having a place for them to go. That's not jail or their hospital department, emergency department room, through crisis receiving and stabilization services. And then most important, in kind of my opinion, to all of this, right, is how are we going to pay for this? Where does the money come from? And so the model legislation includes a 988 fund and fee. So in the federal legislation that was passed, kind of outlined that states, if they wanted, could levy a fee very similar to how 911 is funded in many states, including Maryland, on telephone users. And it's really important, sorry, if we just go back 1 second to the 988 fund, because I really want to emphasize that, we see a lot of times when folks generate revenue that sometimes it's not always used for how it was originally intended. So having a state 988 fund is really important because then you can sequester the funds and making sure that any funds being generated for the purpose of 988 is used specifically for the 988 crisis continuum. So that can include building capacity at the centers, the mobile crisis team pieces, the crisis receiving pieces, kind of any of the crisis continuum. But if they're just in the general budget, then that leaves open to the state kind of repurposing money, in rainy day situations or other times of need, or, oh, we see that you're not using this, so we'll take this. So it's really important, and we always stress to states of having a 988 fund, in addition to a 988 fee, or kind of if you're waiting on the fee, just making sure that you have kind of a protected, sequestered account to put any dollars that may come in from the feds, from the states, or from a fee revenue generation. So if we very quickly turn to just a snapshot of state legislative activity, this is for the 2021 session, and some of this may carry over to the 2022 session based on your state legislative procedures. You'll see here that we do have a number of states, the states that are in green, that were able to pass some piece of the legislation. Again, the model legislation is just a model, so states are able to augment that and supplement that to what works best for their states. But we see, a lot of states really taking this up. The states that are in orange are states that are still active. We have California and Kansas in yellow because their legislation was introduced in 21, didn't pass quite yet, but is eligible to come back in 2022. So there is just a kind of, again, a lot of activity happening at the state level. And not all the states are including a fee, but at least thinking through some of those portions and thinking through how to sequester funds and thinking through revenue generation and costs. So next slide. Another kind of piece I want to touch very quickly on is capacity building. We know that there is a workforce shortage and workforce issues currently. And so just thinking through how some other states have approached this. Again, it's not a requirement of the Lifeline to have licensed individuals answering the telephone lines, although they are important when we talk about supervision. But other states like Nevada are thinking through how can we expand the field to ensure that people who are well-trained can be a part of the lines. Washington State has a steering committee. A lot of states are looking at how to incorporate peers and others to help with the capacity. Next slide. And again, I just wanted to leave you all with this notion that this should be a braided approach. So again, we're hopeful that there will be support from the federal government, state government, fee generation, or other sources, but they should not supplant each other. The state should continue to do and invest in crisis services in addition to these new revenue sources, in addition to what may come down from the federal government. So we hope that this is kind of part of a broader approach and not just limited to a single source. Next slide. So I'll turn it over to my colleague, Matt, here.
Thanks so much, Laura. Pleasure to be here speaking with all of you today about what Vibrant and Lifeline is doing to prepare for 988. So as Laura mentioned, Vibrant Emotional Health based in New York City is the administrator of the SAMHSA grant for the Lifeline. And whereas Laura's a employee of Vibrant, I'm an employee of the grant contract for Lifeline. And we bid for the latest funding proposal to continue administering the Lifeline starting in this past month in October. So this summer we successfully competed for the bid for that. So we will continue to be the administrators of the Lifeline network and thus the 988 network for the next 5 years. And part of the process, both in the wrapping of our prior contract and this new 5-year contract, was to try and do what we could to help states get ready for 988 within the context of the Lifeline network that already exists. And so one of the things that we did is we used private donation funds to award 50 state planning grants for 988. Maryland was one of the awardees of these grants. Technically speaking, there were 46 states that were awarded these grants. 3 US territories, Guam, American Samoa, and Puerto Rico, and then also the District of Columbia. These 988 state planning grants were all based around 8 core planning assumptions. So we've been spending the last year providing an extensive amount of technical assistance to the state agencies and their key partners around these 8 core planning areas. And then we're asking states to write implementation plans, again, using these 8 core planning areas as the base. So let's walk through what those 8 core planning areas are, which many of you have been receiving some materials about over the course of this past year. The first is a fundamental assumption that leading into 988, every state and territory should have 24/7 statewide coverage for calls at least. So what we're saying by that is by July of this upcoming summer, we want 24/7 primary coverage for 988 calls in every state. And the good news is almost all states already have that, but not all do. Maryland is one of those states that currently, through the consortium of the 8 current Lifeline centers, currently provides 24/7 coverage for all calls. We're also saying that we want states to get to the point where they are also having that level of coverage for 988 chats and texts, and that they put plans in place to provide follow-up calls for those 988 callers who are eligible based on certain criteria and who consent. Now, the metrics that we have for when states should be ready to handle 24/7 coverage for calls, chats, and provide follow-up, there's a little bit more flexibility on that. The second core funding assumption is one Laura already touched on, which is that it really takes a diversified set of funding strategies to support the Lifeline member centers, particularly as we consider the volume increases that Laura just spoke about. So many centers, many states, I should say, have been looking at mental health block grant funds. Some are looking into Medicaid reimbursements for certain kinds of 988 related services. The state legislation that Laura went in detail about, that's a key strategy for many states. We have a number of states who are getting ready for their next legislative session now and starting to put bills together. Number 3 of the core planning assumption is that we have provided every state with volume growth assumptions, as well as cost assumptions. Now, these are using some very broad national level assumptions, but it does assume, based on a medium growth assumption, that there will be a large number of calls that might get diverted from 911, from EMS, and even other existing crisis lines. And I'll talk about that in relation to Maryland here in just a second. So we want states to plan around those assumptions or create their own volume and cost assumptions based on more localized knowledge than we had at the Lifeline. Fourth is we're asking state agencies to support the clinical, the operational, the performance standards that we have for our network. So what that pragmatically means is if a state is issuing an RFP, for example, or an OFO, to try and get funding in the hands of these centers, we're asking that the states wrap in our minimum requirements and our clinical expectations into those proposals, and they're certainly able to go above and beyond those if they wish. Fifth is that multi-stakeholder input, external input to the state agency is very important leading into 988. And we know Maryland and many of you on this call have been a part of the 988 coalition, and we're really thankful for that external input. We've made a particular focus at Vibrant to try and push states to make sure that their 988 coalitions represent a diverse group of voices. So we've been particularly emphasizing the importance of voices of lived experience and peers in coalitions, as well as communities of color and other groups that have been historically marginalized. And we want to see that external input, not just leading right up into July launch of 988, but throughout the first year and beyond, frankly, of 988, because we think that that external input to the state agency is absolutely critical. Another key member that has been essential on the coalitions is making sure that 911 and PSAP, dispatch centers are also part of this discussion, so we can talk about the appropriate transfer back and forth between 911 and the Lifeline centers and vice versa. Number 6 is that states must support the Lifeline centers to ensure strong and robust local referral resources. And you all are in a great position because of the strength of the 211 services in Maryland and 211 Press One and the range of services that have been provided in the state. So you have access to a very deep set of referral resources that some states don't necessarily always have, and we want to make sure that that information is equally shared amongst all the Lifeline member centers so that they can make the best referrals possible. Number 7, I hinted at briefly before, is that we are expecting that follow-up services are embedded into 988 calls, chats, and texts for all people who are eligible based on our minimum criteria and who consent. Our best estimate is that about 5% of the 988 volume, whether calls, chats, or texts, about 5% of those would be people who are eligible based on our criteria, which would say that if the person has presented suicide risk in the last 24 hours, that immediately should make them eligible. States could certainly broaden the criteria beyond that if they wish. So that by the time you look at those who are eligible, who have then consented to it, and who then have been successfully contacted for follow-up, we estimate that's about 5% of the volume. And finally, number 8 is consistency in public messaging. So it's very important that we, Lifeline, SAMHSA, state agencies, and centers are as in sync as possible about public messaging. And we're still awaiting guidance ourselves from SAMHSA about some of the sort of benchmarks and the sideboards around public messaging. Some of the key aspects of that include what is the range of services, or how broad is the scope of 988. And Laura had a slide earlier which specifically laid out the language of the law, which says that 988 is essentially a mental health crisis and suicide response line. So being as consistent as we can about public messaging is key. And our point on this is basically, if you're in an emotional crisis of any kind for any reason, 988 is an appropriate place to call. We recognize in Maryland there's also, again, 211 Press One. So there's that combination of services in the state. Next slide, please. Next slide talks about the role and the membership of the coalition, the 988 coalition. Because you all are very active and have a strong program in place already in Maryland, we won't spend time on this slide, but it'll be here for sort of the record, I guess you would say. But these are the kind of expectations we've been placing on all the other states about who, at a minimum, should be a part of the 988 planning coalition. Next slide. So here's our timeline for where we're at right now. Basically, all states have submitted their draft 988 implementation plans September 30th. We're in the process of an extensive review process and getting those feedback back to the states. I believe Maryland's feedback is already in hand, or should be here within a day or two. And then we basically continue in what we call phase 1 of 988, which is activities from now until the actual launch in June. And then we begin the activation of 988 on July 16th. And then phase 2 activities, at least for the purposes of the 988 planning grant, span the first year of 988. And we basically are saying that there needs to be a minimum in-state answer rate of 80%. Maryland already exceeds that, thankfully. But SAMHSA may actually be laying on some higher requirements if and when they issue additional funding opportunities to states. They may be expecting states to step up more quickly to provide chat coverage and reach 90% answer rates for calls sooner than we at Vibrant have, because SAMHSA has additional funds they may be able to release. So they get to call the shots. Next slide. Finally, we'll say that, if you all are having other members of the public asking about 988 and how they can support efforts, obviously you have your coalition, you have the state agency, but at a minimum, we say to members of the public, find the name and the location of your closest Lifeline member center. And we have a map on our website. There's a link right there on that slide. And go find out who they are. Call them up, go visit them, and say, what do you need as a local center for my support as a member of the public leading into 988? And we really encourage those sort of individuals to also join forces with organizations like the American Foundation for Suicide Prevention, NAMI, MHA, and understand what the centers need and amplify that message so that when states do consider telecom fees or state legislation. There's a larger chorus of people supporting it and speaking about the very real needs that the crisis contact centers will have in terms of dealing with the increased volume. Next slide is just our contact information. You can reach us at our Vibrant email addresses. This will be part of the historical record also. And with that, I'll turn it back to Dan.
Thanks, Matt, and thanks, Laura, for that great presentation. There's been a couple questions. We want to save questions for the end, but we will be sharing these slides in advance. And if folks have questions, I know there's a couple of raised hands as well, please drop them in the chat so we can start thinking about them. But for the purposes of time, we're going to save most questions for the end of the webinar. So with that, I'm gonna take it over from here. Matt and Laura provided a really great kind of national level overview of 988 implementation. I'll be talking about what has happened here in Maryland and why we're launching the 988 Fund campaign to build upon the planning that's gone on so far. So as we've already mentioned, there's 8 Lifeline call centers or contact centers today. Maryland does pretty well in terms of its in-state answer rate, 81% at last measure. And 3 of those 8 have text and chat capabilities. The degree to which those contact centers are integrated with mobile crisis team dispatch or crisis stabilization or other community mental health services varies. But a lot of the call centers do have different services that they can provide and different connections they can make. And like was also mentioned, we've also made significant investments in 211 Press 1 here in Maryland, which it's a little bit of a blessing and a curse because we've made such investments. We have to decide what we're going to do with this separate system that is 211 Press 1 and how that's going to coordinate with 988. But it does mean that we have a really strong network today. But with that said, there's a lot more we need to do to really take advantage of 988 implementation and transform the system to be a true alternative to 911 that can be depended upon in the same way. We expect an increase in volume when 988 launches, thanks to marketing and just increased need in the wake of the pandemic. We'd like to increase our in-state answer rate to 90%. We'd like all contact centers to have text and chat capabilities and have 24/7 services. We have statewide 24/7 coverage and statewide text and chat coverage, but it's not always going to be your local contact center that's able to take it depending on the time of day. And so we'd love to see that expand. And we'd like to have more consistent and dependable access to the broad array of crisis response services that someone might need. I work at Behavioral Health System Baltimore, working on the GBRICS partnership, the Greater Baltimore Regional Integrated Crisis System. I think many folks are familiar with it, but we estimated when we were drafting the proposal for GBRICS that the Greater Baltimore region only has currently at 20% of the capacity we need to respond to everyone who might need a mobile crisis team. Similarly, crisis stabilization is not available throughout the state. So there's a lot of opportunity to increase our capacity, a lot of need to increase our capacity. And the 988 Planning Coalition saw this. As Matt mentioned, like most states convened a 988 Planning Coalition, and it should be said that this is different than the MD 988 Fund Coalition, which is an advocacy coalition that we're convening and launching in the and statewide, but is not a publicly condoned thing. This is something that the Planning Coalition is convened by the Behavioral Health Administration, funded by Vibrant, and they also saw that funding and capacity were key. They addressed all 8 of those things that Matt was discussing, but their top 3 priorities were identifying funding, increasing capacity, and ensuring smooth coordination across all the different initiatives and parts of the continuum. They did mention, the draft plan. As far as I know, estimated that at least $8 million would be needed in year one to support call centers. Vibrant's estimates were 10 to 17 million just for the call centers. And the state has requested so far 4 million in American Rescue Plan funds from mental health block grant expansion that was included there. So there's a gap even to get to what the Planning Coalition recommended, and an even bigger gap to get to what Vibrant estimates is needed for year one. And that's just for call centers. So I think we're in agreement that funding is needed, but we would like to see the state take a stronger action to allocate that funding and to build on the planning and decisions that have been made in this planning coalition to more fully take advantage of the transition to 988. So to do that, we're launching a coalition of advocates and community-based organizations called the MD 988 Fund Coalition. Branding subject to change, I'll say. But the MD 988 Fund Coalition is something that we're launching this week. There's been a resolution that's been going around that about 36 organizations have endorsed so far. And the resolution has a lot of information on it, but essentially the organizations that endorse it are committing to pursuing 3 priorities in the near term. It is to establish 988 as Maryland's behavioral health crisis hotline, establishing a 988 trust fund to invest in crisis services over many years, over the long term, and to allocate at least 10 million in calendar year 22, fiscal year 23 to support 988 implementation. So that is what the coalition stands for. And we're really excited that we've gotten so many endorsements so far. And we hope that many of the folks here on this webinar, we got 78 attendees, which is great, will consider endorsing the campaign and joining the coalition as well. What the coalition will be working on in the near term is a legislative strategy to achieve the goals that we just described. We're going to be pursuing legislation in 2022 here in Maryland to establish that 988 trust fund. And that trust fund will be a place where funding and resources can be deposited to support the range of 988 implementation needs, and will help the state to kind of make those investments in a systematic way so that this system of 988 contact centers and the related continuum of crisis intervention and response services can be invested in with a plan and coming all from the same source of the trust fund. So we think establishing that in 2022 would be a big victory and a big first step towards developing a long-term funding and implementation plan for 988. We'll also be educating lawmakers throughout the session around 988. This webinar is a first start, but we hope to, through hearings and meetings with legislators, continue to educate about the importance of 988 and the opportunity that it represents. We sent a letter to the governor asking that he appropriate $10 million to support 988 implementation in FY23. And we'll be working with the legislature to support that as well. We want to continue to research what level of investment is needed for a robust crisis continuum, both the call centers and the other services. So we'll be continuing to gather that information. And we are choosing to not pursue a 988 surcharge right now. So we're not going to be seeking to enact that in 2022. There is a great deal of federal funding available right now. The state has a budget surplus. And so we think that we can identify funding to get this implementation process started this year without levying that new charge. But by establishing the trust fund, it means that the kind of the accounting mechanism needed for a surcharge will already be in place down the line if and when we decide to pursue that. So that's our strategy for the near term. We're going to need all the help we can get to get all that done. And so there's a lot of ways that you can get involved, and we encourage you to do so. The first is to endorse our resolution. We can send it out to everyone who attended, and it's also on our website that Adrian mentioned before, and that's at the end of these slides. We're hosting a coalition kickoff tomorrow at 2 p.m. And so if you're interested, endorse the resolution or reach out to us, and we'd be happy to share that information with you. Help us to gather information to support crisis investments. Help us to build support for the campaign and coalition by reaching out to other partners and getting them to endorse. And keep an eye out for other opportunities to educate legislators, other key stakeholders, and to participate in future calls of action. So that's sort of like what's happening here in Maryland from the coalition's perspective. And now I'm going to kick it back to Adrian to moderate a panel of our current coalition members.
Great, thank you, Dan. So as we mentioned earlier, we've got a panel of existing coalition members that have already endorsed this campaign. And I'll also note, as of today, we have 35 organizations that have signed on to the MD 988 or fund campaign. So you're going to hear from just 3 of the many partners that have already signed on to it. And we're going to start with Katie Rouse from On Our Own of Maryland.
Well, hello and good afternoon, everyone. I hope that you all are warm and well, and thanks again for being here today to talk about this very exciting initiative. Can I get a slide? So there's some there we go. Yeah, some pictures while I talk. Fantastic. So my name is Katie Rouse. I'm the Executive Director of On Our Own of Maryland, and we're a peer-run statewide behavioral health education and advocacy organization that's been supporting and advancing the rights, needs, interests, and priorities of people who use mental health and behavioral health services for over 30 years. Our 30th anniversary is coming up next year, 2022. We've been part of the Maryland 988 Planning Coalition that was mentioned, and many state and regional committees that are working to improve our crisis service systems. Now, you might recognize us from one of our many education and advocacy initiatives, which include our anti-stigma project, workshops in public education, our transitional age youth outreach project, which also supports peers in first episode and early intervention programs, our RAP outreach project, which has brought this peer-run self-help resource to hundreds of peers across the state, or perhaps our network of over 20 affiliated peer-run wellness and recovery centers, which offer free peer support and resource connections to any community member who comes in who's on a recovery journey. Doesn't matter what your diagnosis is or your insurance status. And our network prevents and helps resolve behavioral health crisis situations every day because we offer an accessible, welcoming, non-judgmental, and supportive recovery community. And we nurture lasting peer support relationships based in hope and in mutuality. So if we can advance to the next slide. As you've heard, 988 really offers the opportunity to make behavioral health crisis support services more accessible and more available to everyone, especially folks who may be experiencing a challenge for the first time, which we know is happening and will keep happening even more under the continuing stress of the COVID pandemic. When we think about 988 from a service user or peer perspective, there are 3 big 8s that stand out. First, 988 appreciates that behavioral health crises deserve a behavioral health response. Many crises grow out of someone not feeling seen or heard, or not having the relationships or resources in place to support their wellness and recovery. What we need in these moments is to be treated as people, not as problems, as being distressed, not dangerous, and as needing support and safety, not stigma or seclusion. And since 988 is grounded in the behavioral health world, it will connect folks with support professionals, including peer support specialists, who have the skills and the understanding to help someone reactivate their own coping and calming skills, or assist them in, in choosing more intensive supports that are going to meet their needs. So the second thing is that 988 accelerates that connection to supports and services that are helpful. When you're already feeling low or out of control, having to wait to be connected to someone who could help you, or having to explain your situation to someone who doesn't understand, or worse, who might hold stigmatizing attitudes about mental illness or addiction, Both of these things can be real barriers to staying engaged long enough to actually get the help that you need or get the support that you want, or they can even prevent you from reaching out in the first place. So one of the big enhancements that can come with 988 Fund is ensuring that all of our hardworking call centers have the staff and the capacity to continue staying really well connected with available clinical and community resources that can support people not only during this moment of crisis, but after, right, for the rest of your life to create that ongoing wellness and recovery. So the third thing is that the 988 Fund really anticipates that we all experience behavioral health challenges during our lives, and that it may one day be our colleague or our family member or ourselves who are calling for help. With 988 coming out this summer, we have this incredible opportunity, a combination of public awareness and potentially available funding. And we really implore Maryland not to miss that. By strengthening and enhancing high quality, recovery-oriented, trauma-informed, accessible, and equitable behavioral health services, we can prevent the trauma and the tragedies that happen especially for members of marginalized communities and historically oppressed groups, if untrained or unskilled or unprepared responders are the first or only folks to come when there's a behavioral health crisis. We know that we can do better with our crisis response system. We know how we can do better. And we have this phenomenal community of peers who have been on all sides of crisis response, receiving and giving support, who are ready to help push Maryland's 988 and crisis response services to the next level. So I strongly encourage you all to be a part of this effort to transform and improve our crisis response systems and to destigmatize asking for support in a behavioral health crisis. Thank you.
Thanks, Katie. Now I'd like to turn it over to Jonathan Davis from BCRI.
Good afternoon, everyone. My name is Jonathan Davis, and I am the Executive Director for Baltimore Crisis Response, located here in Baltimore City. BCRI is Baltimore's first and only comprehensive crisis service provider. Our services range from a 24/7, 365 telephone crisis, information and referral line, a detox program, residential crisis and addiction treatment, mobile crisis teams, HIV and hepatitis C outreach and prevention, police education and training, community education and outreach, and we are piloting the 911 diversion program with Baltimore Police Department. We are super excited to be endorsing our Maryland 988 Fund campaign. Some of the benefits that BCRI see for supporting this particular initiative, that the Maryland 988 will mitigate service barriers, allow for deployment of appropriate resources and responses to community crisis, and facilitate equitability in the system by ensuring the entire region benefits from a robust crisis management system. Additionally, potentially allow for ongoing funding to commit to future enhancements into the crisis management system to focus on capacity, quality of services, and sustainability. And lastly, it will allow for easy access to crisis services through a simple 3-digit number. Again, we are super excited to endorse this resolution. We will continue to support this resolution by providing education to organizations and individuals in our network, and we encourage you all to do the same. Thank you.
Thanks, Jonathan. And last but not least, we have Laura Torres.
Hi, I'm Laura Torres, and I am a behavioral health program manager at Howard County General Hospital, a social worker by training, and spent many years in the field working with people who are in need of all different types of behavioral health services. Next slide. So Howard County General Hospital is a Johns Hopkins affiliate, and we are the only hospital in Howard County. So we receive many patients in our emergency room on a daily basis. Many of those patients are experiencing mental health crises. And this is something that is seen across the state. Many emergency rooms are seeing a lot of people who are experiencing behavioral health crises. So some of the people that come into our emergency room do need to be there, and they do need that level of care, but many of them do not. So if you've not been to the ER, I'm going to give you a just very quick overview. It's very long, especially if you're there for behavioral health reasons. It can be arduous and expensive, and it's expensive for the person receiving care, for their family members, and also for different insurance companies. So it's not the most effective way to receive treatment, nor is it the most appropriate way. So we are endorsing 988 because we are currently working in partnerships and collaborating with many other organizations across Howard County, and have been for the past several years, to try to improve and better support people who are experiencing mental health crises. So at the hospital, we work with our county police department, our county government, our mobile crisis program, which is Grassroots and the Horizon Foundation, as well as many other community groups and organizations. We've been working separately and collaboratively to really improve the experience and outcomes for people with behavioral health crisis. Recently, I'm happy to say all of the organizations that I've mentioned are working together to support GBRICS, or the Greater Regional Integrated Crisis System. And through this partnership, we're hoping to improve services even more in Howard County and across the greater Baltimore region. We have seen in Howard County that there are some positive improvements through these collaborations and these networks that we've been involved in. We are a little bit ahead of the game in that there is now a link available. If a person calls 911 in Howard County, they can be directly connected to a professional counselor with our mobile crisis program. So we've already seen benefits, and we know that calling 988 will provide a similar and smoother process, since the caller will be directly connected with a trained counselor who's equipped to support them in dealing with their individual crisis and assess the most appropriate and comprehensive response for that person. 988 will provide an entry point into a full continuum of care that includes speaking with a caller over the phone, providing an assessment potentially in the community, and referring the person to the appropriate level and type of care. All of these are components of our GBRICS model as well. So as a social worker in my role as the behavioral health program manager at Howard County and a GBRICS contributor, I see that 988 is key to ensuring that the community has the necessary and comprehensive resources to support the people experiencing mental health crisis by providing them with the services needed to assess the person's behavioral health needs, ensure that the person is safe, and connect them to the appropriate level and type of care that is needed to address their needs. So as we heard earlier, there are other states that are using similar 988 evidence-based models and have had success and seen improvements with a decrease in the number of people seen in ERs and an increase in connections to behavioral health services and resources. The use of a 988 system will improve the experience and outcomes for the user and decrease the cost of care for them, for hospitals, and many of the other partners involved in the care of community members. Addressing and caring for the behavioral needs of the community through 988 cannot happen without a financial investment and ongoing support. Current legislation does not include funding, and that requires that each of the individual states needs to determine and figure out how to finance it. So Howard County General Hospital supports MD 988 because we believe that all people experiencing a behavioral health crisis deserve timely and effective treatment carried out by behavioral health professionals in a setting that is conducive to meeting their needs when they are most needed, and not hours or days later. We believe it's the responsibility of the state to establish a fund to invest in call centers that are available 24 hours a day, 7 days a week, by allocating the initial $10 million of funding requested in FY23 to ensure that these services occur and are successful. So thanks for allowing me to come and share.
Thanks, Laura, and thanks to all of our panelists who presented today. So we now have about 10 minutes left for question and answer. I have noticed that we have questions coming in both the chat and the Q&A. So to help manage the questions, I ask that you, any questions you have, put in the Q&A. If you look at the toolbar on the top of your screen, you'll see there's a chat bubble and a Q&A bubble. The Q&A has 2 bubbles. That is where I'm asking that you please put your questions. It's a little difficult to track questions in the chat because I saw lots of names and organizations. I also just want to note, Katie, I saw lots of happy early anniversaries and yays for your announcement on our own 30th anniversary coming up. So do want to give you a shout out for that. So with the questions, we have 3 questions, a couple of questions that have already come in through the Q&A. I'm going to do my best to get us through all of them. So we have our first question is, how will the 988 coalition efforts work with GBRICS? I can take a stab at that, and then maybe also Dan, if you've got anything to add. GBRICS, I'll just say GBRICS is one partner that's part of the broader 988 coalition. The other regional partnerships, of which there are 3 across the state of Maryland, there's Tribe and there's Totally Linking Care, in addition to GBRICS. They are also getting involved with this broader coalition. So it is a broader statewide effort. GBRICS is a regional focus. Our next question is, does MDH have the same priorities plans listed on slide 21? Need for increased crisis response capacity. Dan, I believe this one is for you.
Sure. Yeah, I think for the most part, you know, the priorities that were listed on slide 21 for everyone's reference was that a goal to increase the in-state answer rate to 90% from its range between 80 and 85% today. I believe that the state is committed to that. The Department of Health is committed to that. And the desire to expand text and chat capabilities and 24/7 services. MDH is committed to that, and a desire to provide consistent and dependable services across the crisis response continuum. I think the state's committed to that too, although that last one is a little less well-defined. You know, the 988 Planning Coalition that the Behavioral Health Administration convened over the summer didn't go into too much depth when it comes to capacity outside of the call centers. And so I think that's a little more fuzzy, but there are lots of other things going on in the state right now besides just that 988 Planning Coalition. The state's pursuing Medicaid funding for mobile crisis and crisis stabilization, or researching how to go about doing that. There's a number of other kind of work groups and convenings that occur all the time. So I think that the state is committed to doing that, and the legislation that we're pursuing is just designed to kind of help facilitate that and help demonstrate the support that the General Assembly also has for expanding out those services.
Thanks, Dan. We have a question, will the implementation plans be made public? I think this is probably for Vibrant. I think the question's referring to the implementation plans that the states are currently submitting to you. Do you know if they'll be made public once they're finalized?
Yeah, so the final plans are due January 21st, 2022. We're going to have a short period after that where we'll just identify any final points of clarification that are needed to the state. And then we plan on making these plans available to SAMHSA. These are private donation funded plans, I guess, if you will. In other words, the grant that was the occasion for these plans to be developed were private donation funds. And so from our perspective, these plans are in the ownership of the state agency that submitted it. And so we'll leave that to decision as to whether or not the states will be releasing their individual implementation plans publicly. But we will be making these available to SAMHSA so that SAMHSA has a clear understanding of the roadmaps the states are laying out. I will say that many parts of these plans are are they're broad and they're multi-year and they're not set in stone. So we created this funding opportunity as a way of a way for states to receive TA, technical assistance, and get ready for 988 with us. The word final, in terms of these being final 988 implementation plans, that word final really was only from the perspective of the grant coming to a conclusion. We imagine that these implementation plans are living documents that will go through frequent revisions, and we don't see them as decisions sort of set in stone necessarily, but really planning guides for the state agencies. So if the states do decide to release these plans publicly, I think it'll be important to frame it so that it's not understood to be that these are plans which will never be modified. And that these are more iterative documents.
Thanks, Matt. And we've got one other question that I think also is for you. How often will the local referral listings be reviewed and updated?
Yeah, well, we've asked that state agencies facilitate the review of those annually, and that they make then those lists also available to us, because down the road, we plan on having a unified platform where as many call centers and chat centers are on the same technology platform as possible. It's not something we're going to force on states. We're actually going to be funding the development of this platform. So we'd like to have as many of those state level referral listings as possible, so that when calls or chats roll into our national backup network, those counselors who are out of state who end up answering some Maryland 988 calls, they'll be able to look at that same referral resource listing as the in-state centers would. But once a year is the expectation we're placing on state agencies.
And Adrian,
Great.
if I
I
could
think
jump
we
in,
have-
I know there's a question in the chat that never made it to the Q&A, but I think it's a really good one, which is essentially, how will 988 influence the role of law enforcement in crisis response? So I don't know if you want to touch on that, or if anyone.
Sure.
wants to talk about it.
This was sort of hinted at in one of the other presenters. 988 is seen as let's be clear, right? 988 in a sense already exists because the Lifeline network exists as a 1-800 number. 988 is going to be easier to remember, and it's going to make access to mental health services more equitable, more convenient, easier to remember. So what we're asking through the 988 planning grants is that the state agencies and the centers really advance their partnerships with 911 centers. I mentioned that in my comments, so that there's a better referral process back and forth. Ultimately, we hope that many calls are diverted away from 911 into 988, because the vast majority of people in an emotional crisis do not need a law enforcement response or even a mental health crisis response. And currently, a mobile crisis response. And currently, the kind of is the default action when mental health crisis calls end up at 911. So we're hoping to divert a lot of those calls away. I hope that answers the question. But ultimately, at the end of the day, if a 988 call is deemed as an imminent risk to self or others, the center should be able to patch in 911 to be able to dispatch law enforcement or the MCTs, if that's how that's done. In the same manner, what we really hope to get to is a place where the 911 dispatchers have gone through some training alongside the Lifeline member centers, and they say, hey, this is a mental health crisis call. We need to warm transfer this over to the 988 centers rather than defaulting to a law enforcement response.
Hey, thanks, Matt. We've got time for one last it's actually 1 o'clock. So we don't have time for one last question. I apologize. But I do want to note that if you do have questions that were not answered, the next slide I'm about to go to will give you information on how you can follow up and make sure that your question is addressed. So just to reiterate, join the campaign. Join it today if you haven't already joined it. You can endorse the resolution. You can access that on the website that was dropped into the chat, which is www.fundmd988.org. If you can't find that, you can contact us at the email that I'll provide in the next slide. Continue to educate your network. I know that many of you on the webinar today are already engaged in educating your network. You've been reaching out to legislators. You've been talking to people in your community. Keep up that good work and join the coalition. The coalition kickoff meeting is tomorrow at 2 o'clock. You can still have time to get involved in the coalition and join us for the kickoff meeting and future meetings. As Dan outlined, we do have a legislative strategy, so we anticipate that we'll be meeting a lot over the next several months as we gear up for the Maryland legislative session. There's the website I mentioned. Visit that website to access the resolution and gain more information about what the campaign is focused on. If you have trouble finding the resolution, you can email us at that email md988 at bhsb.org. Thank you all for joining us for this webinar today. Again, this was recorded and it'll be made available on the Fund MD988 website. And thank you to our panelists for your participation. Take care, everyone.
Thanks, everyone. Have a great day.